I want to talk a little bit about James, who we just heard from. James walked out of the hospital with a $45,000 unpaid hospital bill that he had no way of being able to pay. Now, first of all, I guarantee you, no member of Congress ever walks out of a hospital with a $45,000 unpaid hospital bill. And by the way, no member of the New York State Legislature walks out of the hospital with a $45,000 And, you know, James is not your mythical freeloader trying to mooch off society. James is a young, hard-working person just trying to make his way in the world. You know, if that hospital had 2 or 3 people like James leaving every day, and if it's a good-sized hospital, it probably does have 2 or 3 people leaving every day like James. They're not out $45,000. Simple arithmetic, they're out $45 million if it's 3 people a day. Now, what happens? What happens is they have to cut something. Whether it's nurses, whether it's who knows what. But when a hospital loses Medicaid money, when it loses money because a patient can't afford to pay the unpaid bill because they have a huge deductible or because they don't have insurance at all, they don't just cut health care for the Medicaid patient. When they cut back, even the wealthiest New Yorker arriving at that hospital with a heart attack is going to get care that is stretched thinner and lower quality as a result of that cutback, and have a higher chance of not going home on their own 2 feet. That's what those cutbacks mean, not just to James, but to even the wealthiest New Yorker going to the same hospital that James went to. It's not enough, though, to talk about what we are against. We're against slashing Medicaid. We're against slashing health coverage for working people. We're against slashing Medicare and turning it over to insurance companies, which is the next piece on the Republican agenda. But if we want to win, we have to talk about what we're for. And what we're for is health care as a human right, health care for every man, woman, and child, health care that is not burdened by the enormous, crushing administrative costs of insurance companies and healthcare providers who have to fight with insurance companies. We want health care without financial obstacles and barriers to care, so that people get the health care they need and the family financial stability that they deserve. And the only way that New York can do that is by enacting the New York Health Act for universal, improved Medicare for all. We need to fight back against what Trump and the Republicans are trying to do. And the best way to fight back is to show what we're for, so that New York can help take the lead and eventually lead the whole country. Thank you.